I'm assuming it's good afternoon, no longer good morning. Good afternoon, everyone. First of all, I want to thank everyone for their patience and understanding over the last few days at our testing clinics with public health and everyone across P.E.I. and across our system who have been working so hard on the COVID-19 response. Though we are 22 months into this life-altering reality, the past few days we are seeing levels of infection that we haven't seen since the onset of this pandemic. This surge in cases is disappointing and it's discouraging in so many ways, but it is the reality that we find ourselves in. Every province and jurisdiction across the country is seeing a dramatic surge in the level of cases, and each have faced the difficulty of making tough decisions to try to protect the public health. This is not the situation we had planned to be in, and I know that families and communities are again seeing their daily lives impacted. And I can honestly say from the bottom of my heart that I'm very sorry that we're going through this. And I promise you that we are doing everything we can to try to get through this as fast as we can with the focus on remaining as safe and healthy as we can. I would also like to take a moment to speak directly to those hundreds of individuals and families who are in isolation right now in relation to the recent cases. Some of you will be spending Christmas in isolation, and that is a really difficult situation to be in. Christmas is a time for family, for togetherness, for the spreading of love and joy, and I hate that too many Islanders aren't able to feel the full extent of this, especially at a time when we are in so much need of it. But I hope you know that by isolating, that you are giving a gift of thoughtfulness and kindness to others by doing your part to help stop the spread of COVID-19 in our province. As all Islanders, I don't have to tell you that we're in the thick of this, and there's no simple or fast way out of it. This Omicron variant is a different beast. It spreads like wildfire, it sees no boundaries, and it pulls no punches. And for those reasons, we must, as a province, do everything we can to try to slow the spread of the variant. The health protocols that we have in place are designed to serve two critical purposes. One, to try to reduce the spread of the variant in our province to protect the health and safety of our citizens. And two, and in doing so, to ensure that we're doing everything we can and taking every precaution we can to try to get things back to normal in our province as soon as possible. There are new measures that we need to implement today, and they have the same design. They, like our previous measures, are made using the best and most up-to-date science and health information that we have. We know that the importation of the virus remains our biggest challenge. We had asked Islanders previously and visitors to our province not to travel unless it is deemed essential. But now we have to go a little bit further. Starting tomorrow at 8 a.m., anyone arriving from out of province will be required to isolate for 4 days. Every traveler entering the province will be given 2 rapid tests and will be required to complete the test at day 2 and day 4. And if both tests are negative, that individual can leave isolation. If a traveler chooses to isolate with others, the entire group or family will be required to isolate as well. In addition, we are requiring the closing time for all bars and restaurants to be 11 p.m. Both of these measures will take effect tomorrow at 8 a.m. It is with a heavy and a conflicted heart that we make this announcement today. We have never planned and wanted to go back to this. But if we want to stop the spread of the virus, to get our children back to school safely, to get our kids' activities and sports restarted, and to get back to some kind of normal in our province, we need to do this. We need to do it for a limited time, and therefore we need to take these actions. As Dr. Morrison has said, we need to limit travel. We need to limit our personal interactions. This isn't the time for parties, for gatherings, or staff celebrations. I know this is as hard for some of you to hear as it is for Dr. Morrison and I to say it, but it is the reality we face today and tomorrow, and it requires us to make these difficult decisions. We have been successful as a province because we've had tremendous understanding and adherence to public health protocols from the vast majority of Islanders. We need that now more than ever. I know it's hard. I know we're all tired of it. I know we want to be over it. But until that time comes, we need to continue down this road. And I ask all of you from the bottom of my heart, each and every one of you as Prince Edward Islanders, to continue with your understanding and your adherence to our public health protocols. They are making a difference, and they will get us through this more quickly than if we don't. So with that, I'll turn it over to Dr. Morrison for a more detailed breakdown.
Thank you, Premier. And I just would echo really so much of what you said. It is with conflicted heart and disappointment and discouragement that we are in this place having to face this increasing Omicron variant here in Prince Edward Island, as well as around the country. As of 8 o'clock this morning, there are 29 new cases of COVID-19 to report, bringing our total active cases to 112. The new cases today include 4 people who are not permanent residents but are in P.E.I. and are isolating and being managed by public health. Going forward, individuals who are permanent residents in another jurisdiction and are diagnosed with COVID-19 and P.E.I. will be included in our daily number of new cases, but will not be counted in our active case count or total number of cases, given that they are also included in counts in their home jurisdictions. In the last 7 days, we've had 115 new cases, including 18 cases of the Omicron variant that have been confirmed by the NML. We are awaiting results of genetic sequencing on many of our recent positive samples. Of the cases announced in the last week, 58% are close contacts, 22% were linked to travel within Canada, and 15% linked directly to travel outside of Canada, and 5% were acquired in the community, meaning that we were unable to determine a link to travel or another case. The majority of infections that were acquired through close contact were through close contact with a travel-related case. We have learned in the last week a number of cases have occurred as a result of gatherings, and we saw additional secondary cases as well as household members. We have a large number of people in self-isolation as a result of being close contacts, including a total of 125 students from Montague Consolidated, Belfast Consolidated, and Colonel Grey High Schools. The last case related to the outbreak at Westwood Primary School was reported on December 16th. We do not expect any more cases related to that outbreak, which will be officially declared over 14 days after the last positive case. The modeling in other jurisdictions suggests that the Omicron variant will overtake Delta as the dominant strain very quickly in the next few weeks. And we really need to assume that our cases here in P.E.I. and any new cases are the Omicron variant. In many of our recent cases, the speed and efficiency at which COVID-19 is spreading is very fast, much more quickly than we've seen before. The strain has the ability to spread at lightning speed, infecting a large number of people very quickly. The increased transmissibility of Omicron and increased case counts are concerning. We are in the early days of managing this variant. We can expect to see further rapid increases in cases over the next even 1 to 2 months. And I know we talk about cases, but we also want to look ahead and focus on severe outcomes and hospitalizations, and that is also a big concern. We have heard early reports that Omicron results in less severe disease. But even if the severity of disease caused by Omicron is equal or lower than that of the Delta strain, the increased transmissibility and exponential growth of cases will rapidly outweigh any benefits of potentially reduced severity. Similar to other countries, Canada can expect to see more hospitalizations and deaths from Omicron. We all feel discouraged and disheartened, knowing we are in an uncertain time, and we have a bumpy road ahead. And while we are all tired, this variant does not care if we are weary or how we are feeling. It does not care if the holiday season is upon us. It does not care if we have travel plans or if our loved ones from away want to come home for the holidays. We have to remember that we have many tools at our disposal to fight this wave of the pandemic. We know what measures work, and importantly, we have access to a safe, approved vaccine. So what can we do to protect ourselves and others? And really, we've talked about them before, but we do need to stick to the basics. Our hand washing, getting tested if you have symptoms, wearing a well-fitting 3-layer mask and wearing it properly, staying home when not feeling well, maintaining physical distancing from people outside your household, and keeping your circle of contacts small. Stick to a steady and constant 10 people if you can, and keep it smaller. And most importantly, keep the group consistent. Reducing our personal contacts by at least 50% is key to limiting the spread of Omicron. We also need to have as many people vaccinated as possible. Everyone eligible should receive their booster. We know that 2 doses of the vaccine provides protection against hospitalization and serious illness related to Omicron, but 3 doses provides better protection, and getting a booster is very important. Last week, we announced a number of new measures aimed at controlling the importation and spread of the Omicron variant. As much as island residents did not want to hear about new restrictions as we were entering the holiday season, it was not the news that the Premier or I wanted to be sharing with the province. So last week, we talked about those who travel to P.E.I. are being tested at the points of entry and again on day 4. And we talked about enhanced precautions and almost a modified isolation until they had day 4 testing, and to avoid large organized or personal gatherings and limit visitation to long-term care, acute care, community care facilities. So in addition to that, as the Premier mentioned, we are instituting a mandatory isolation for the first 4 days upon return or when people arrive in Prince Edward Island, with antigen tests being given out at the points of entry for day 2 and day 4 testing. As well, I ask that people not host or attend organized gatherings on New Year's Eve or staff parties over the holidays. These types of activities present a golden opportunity for COVID-19 and its variants to spread from person to person, affecting many individuals and families. We can still get together with friends and family over the holidays with some modifications, and trying to keep to your consistent and steady small group. Also, as the Premier mentioned, licensed establishments, our food premises and bars will stop seated service by 11 p.m. We know that the next number of weeks are going to be rough as we struggle to mitigate the impact of COVID-19. We will not be able to stop this variant, but our concerted individual and collective efforts will be able to help slow it down. And as the Premier mentioned, it's about protecting our system, protecting vulnerable islanders and visitors. And we want the hospital, for instance, to be able to look after us not only if we get COVID, but also to be there and have the capacity to look after us if our child is sick or your partner has a heart attack and needs the health system. I ask all island residents and visitors to be especially cautious over the holidays. The choices we make today matter. Let's all work together and do our part to avoid an even larger spike in new cases after the holiday festivities. Just briefly mention the vaccine as a vaccine update. We have 95.2% of island residents aged 12 and up have received at least 1 dose of vaccine, and 92.1% are fully vaccinated with 2 doses. The vaccine rollout for children aged 5 to 11 is going well, with 34.8% of children in this age group having received their first dose. Last week was a relatively busy one at the vaccine clinics, with almost 4,800 doses administered, of which 32% were first doses and 62% were third doses. Almost 13,000 people have received a third dose or COVID-19 booster. And the demand for booster doses has increased, and pharmacies are adding more clinic appointments to increase capacity to administer third doses. Thank you to all the community pharmacists who've been working tirelessly all year to administer COVID-19 vaccines while continuing all of their other services to Islanders. People should book their booster appointments for 6 months after their last dose. Nationally, there are fewer reports of adverse events associated with the second and third doses of the vaccine. This means there's a reduced chance of experiencing a serious adverse event with the second and third dose of vaccine. And I've said this before, I'll repeat it. Getting vaccinated protects you and others from serious illness and hospitalization related to COVID-19 and its variants. If you've not yet been vaccinated, please book an appointment today. And if you're eligible for a booster dose, please book your appointment today. And appointments can be booked online or calling the vaccine booking line or pharmacy. In terms of contact tracing, the increase in cases in the last few weeks is straining the health system, including public health. The demand for testing has been high, and the staff at all the health P.E.I. clinics and the provincial lab continue to go above and beyond to test as many people as possible. And also the testing that is occurring at our points of entry by staff in those locations have also been working very hard. So thank you to all of them involved in supporting the provincial testing program. In terms of public health, thank you to the nurses and other professionals who've worked long hours to manage cases, conduct contact tracing, and identify public exposure sites in order to try to contain the spread of COVID-19. I mentioned last week that changes in our contact tracing processes may be required in order to cope with the spike in the number of cases in this wave of the pandemic. And we have changed and will continue to change our contact tracing process to adjust to the increased number of cases and close contacts, as our ability to maintain the same level of personal outreach has been exceeded. Effective immediately, anyone identified as a contact of a positive case will most likely receive an email letter from Health P.E.I. in our office indicating you've been identified as a close contact or a casual contact and providing information about the testing and isolation requirements. All close contacts will be contacted, though, by public health, by phone or email. And the difference, I think I made an example gave an example last week of close contacts at a school, in a classroom. They would be identified perhaps by email. But close contacts, as much as possible, will be identified by public health nursing by phone or email. These initial adjustments to case and contact management are just some of the changes we'll need to consider and do so quickly in the coming weeks as the number of cases of COVID-19 continues to rise. I know we've had lots of questions about rapid screening tests. P.E.I. is distributing our limited supply of rapid antigen screening tests in a targeted manner, focusing on the following areas: regular screening for frontline staff who are not fully vaccinated and work in high-risk areas, such as schools, childcare, correctional facilities, healthcare, long-term care, and community care, and group homes. Screening individuals who are traveling to P.E.I. who cannot be tested at points of entry, when in contingency or when too young to be tested at the points of entry. Supporting children to return to in-class learning when there have been cases and outbreaks in schools, and enhancing access to testing for families with young children, especially in areas of the province where there's limited access to PCR testing. Going forward, we are considering allocating more rapid screening tests to long-term care and community care facilities to test all staff, regardless of vaccine status, multiple times each week. And that's in an effort to protect those in those long-term care and community care facilities. Beginning today, we'll be handing out screening tests to people traveling to P.E.I. or returning to P.E.I. to ensure that they have access to testing for their day 4 tests when the health P.E.I. clinics are closed for the Christmas holiday. We will retain a reserve of rapid screening tests to support the provision of essential services, including healthcare, in the event that a large number of frontline staff are identified as close contacts. We will be prepared to implement a test and stay program, rapid tests interspersed with PCR tests to allow frontline staff to continue to be available to provide essential services. Access P.E.I. sites in rural P.E.I. where there's less access to PCR testing have a supply of screening tests for distribution. Tignish, Alberton, O'Leary, Wellington, Montague, and Surrey. We continue to work with the Government of Canada to secure additional home-based screening kits. Rapid screening tests are not appropriate for anyone with symptoms, as they are screening tests as opposed to diagnostic tests. Anyone with symptoms of COVID-19 should be tested at a health P.E.I. testing clinic. These screening tests are not as accurate or reliable as PCR tests. We've had requests for tests to be used by individuals to attend social functions and large gatherings. This is not an appropriate use of the rapid antigen tests. A single negative screening test is not a free ticket or hallway pass to disregard the current public health and travel measures. Some of the kits we receive are in boxes of 25. These boxes have to be dismantled and reassembled into packages that contain 2 kits. So we provide 2 kits and ask individuals with a negative screening test to repeat it in 48 hours. So a special thank you to the staff of the Bell Alliance Centre, Access P.E.I., and other provincial staff who worked to assemble many thousands of the 2-pack kits over the last few days. Your willingness to roll up your sleeves and support this important work is greatly appreciated. And of course, we've also had a number of questions about how the new COVID-19 variant may affect Santa and his reindeer. I received a special news bulletin today from the North Pole this morning, letting me know that Santa is fully vaccinated and he even has his booster dose. Santa is feeling well and is following public health measures, so he and the reindeer can safely visit all the children on Christmas Eve. We can help to make Christmas safe for Santa and everyone by reducing our contacts by at least 50% and keeping our circle of contacts steady, consistent, and small. We need to consider our own risk and that of others when deciding to attend events over the holidays. And as I get to the end here, I know it seems like a long one today. As we were prepared to turn the calendar over to 2022, it is a time to reflect a little bit on the events of the last year. And I think as we put these notes together, we hope that this might have been my last time coming out this year, so I can still be hopeful of that. But although currently we are very focused on the impacts of Omicron, I do want to note a few highlights from 2021. The last year was a challenging year for all individuals, families and businesses in P.E.I. As Islanders, we've drawn on our strengths, demonstrating our resilience, caring, compassion, and kindness. We all hoped the pandemic would be over by now, and we were caught off guard by the sudden and aggressive arrival of the Delta variant and now Omicron. 2021 saw tremendous progress with our vaccine rollout. Thank you to the 133,900 Islanders who chose to be fully vaccinated and the 4,100 children aged 5 to 11 who have received 1 dose. We have excellent testing capacity. Almost 244,000 lab-based PCR tests have been completed since the pandemic began, including almost 5,000 in the last week. In June, in addition to screening, the staff at the points of entry began testing travelers entering P.E.I., including 24-hour, 7 days a week, point-of-care testing for asymptomatic individuals at Borden. Last week alone, almost 14,000 people were tested at the points of entry. In the spring, we implemented the P.E.I. Pass program to expedite travel to P.E.I. and verify vaccine status prior to arrival. Over 462,000 P.E.I. passes were granted by our partners in justice and public safety. We continue to respond to requests for information and complaints from Islanders. The COVID-19 1-800 line, which is really the visitor services team, receives an average of 70 calls per day and responded to over 24,000 calls in 2021. And over 50,000 calls have been received on that line since the pandemic began in March 2020. And of course, the list could be much longer. The accomplishments of 2021 and our success in managing the pandemic since March 2020 is a team effort. And it is thanking individual Islanders, families, communities, organizations, businesses for your support and willingness to respect and support public health measures. Your support and actions have resulted in P.E.I. being known as one of the safest places in Canada, if not the world, throughout the pandemic. Thank you to all the members of the media, whether you're on the phone or here in person, for your patience, support, and genuine desire to communicate the important messages clearly and succinctly to Islanders. Your work has ensured that Island residents are consistently well-informed and up-to-date on the latest COVID-19 developments and public health and travel measures. Thank you to our many partners in the public and private sectors who support the provincial pandemic response, and there are too many to mention. You know who you are. Thank you to each and every one of you for your hard work, dedication, and commitment during the last 22 months. Thank you to your families for their support, allowing you to give 110% to your role to protect the health of Islanders during a global pandemic. The work you do is making a difference. So in closing, I wish each and every Islander a safe holiday season. As the Premier mentioned, it is for family, it's a time of togetherness. And as we continue that journey together throughout COVID-19, the best gift we can give each other at this special time of year is to be patient and kind to ourselves and others. So thank you. Thank you.
Thank you very much, Dr. Morrison. Well said. And with that, I'll turn it over to questions from our friends in the media, and maybe we'll start with Steve Bruce, CBC.
Thanks so much.
Sure.
There are fun announcements for you to make today. Last week when you brought in the new restrictions, we knew then that Omicron was here. You projected there would be a real surge in cases here. So why just make the decision now to bring in this isolation requirement for travelers? What have you seen since last week that tells you, okay, we need to go this far?
I just think the steady rise throughout the region and beyond, obviously, and what we're seeing here. I think Dr. Morrison can add more to this, but we have really tried as hard as we can not to get to this decision, simply because we know this is for many, like my own family. This is the second Christmas in a row where we're probably going to be separated from each other. And we've really tried as hard as we can not to do this. We really hoped initially that we could do this not as a mandatory protocol, but as a people to use the best common sense they have and to limit travel. But at the same time, we're seeing this increase. It's probably even increasing in P.E.I. faster than we thought, and we're just trying to do what we can to use all of the arrows, in the quiver to push this back. As I say, we're not going to be rid of it. We're trying to slow the flow of it, and so it's really been a difficult one because we're trying to also weigh the mental health impacts of this as well, and we know those are great. And we don't want to do this any longer than we have to. But at the end of the day, this is the best decision to make based on the information that we're learning each and every day. But I think Dr. Morrison would echo that it's certainly not the decision we want to be here making today.
No, I agree, Steve. It's when we look at our cases, they are linked the majority of the cases are linked either directly or indirectly to travel. And some of that is happening within the first few days. The Omicron transmission just happens that quickly. And for every case we can prevent transmitting further in P.E.I., we should try to do everything we can to slow this down. We've done that all the way along. And the timing is terrible because of Christmas and holidays. But recognizing that we really are trying to do what we can, as the Premier outlined earlier, just to slow this down, limit the transmission so that we can get more boosters into people, that we can get more people vaccinated. If we can get a little bit more time to do some of that and maybe limit some of the hospitalizations, we should do everything we can. And we've never regretted, and I'm sure the Premier would say this too, we've never regretted trying to do as much as we can to protect Islanders, and realizing it's hard to know how much difference this will make, but every time we are able to pick up a case in those first few days with limited transmission, we are probably helping protect the spread further.
I'm sure some might look at it and say, you know, if I'm in New Brunswick, where there's community transmission, Omicron is there. I want to go to P.E.I. where there's community transmission, Omicron is there. How am I more of a risk coming from New Brunswick than someone that's already in P.E.I. and, you know, going out shopping and seeing people? What would you say to that?
Well, I think one of the differences, and I mean, we've talked about this even within the region amongst the other Atlantic MOHs, and I know the premiers have talked about it. Our epidemiology is a little different in each province. We still have limited community transmission that we're seeing because we're able to, you know, link them to contacts of cases or exposures, and that we can sort of take back to travel. So it's not as, I don't think we don't have the widespread community transmission. It may be that we're doing this, you know, too late. I don't know, but we need to do it because we said last week every day matters. Let's see if we can try to slow this down. So it's, we want to minimize the impact, protect those who could end up in hospital.
Will the travelers still be tested at the border itself, at the points of entry?
Yes. At our airport and at Borden, Wood Islands, I think is being, you know, dismantled. I think the last day for Wood Islands was yesterday. And so, we'll need those testing devices then will be redeployed in other parts of the province.
What will enforcement look like around this and checking in on those that are isolating?
Do you want to?
Yeah, I think that's one of the challenges that we'll face. We're certainly stretched in terms of the resources that we have to do this. We won't be able to operate, you know, Operation Isolation to the extent that we did before. I think that, you know, I think in the days ahead, we will try our best to manage this the best we can. But as I said in my opening comments, that, you know, the strength of our position as a province doing as well as we have has been in the adherence to the public protocols and the health protocols by the general public. And I expect that the vast majority understand why we're doing this. Even if they don't like it, we'll follow along. But I think the enforcement will be a little bit more of a challenge this time, to be honest. And that's one of the things that I know Dr. Morrison has talked about at our cabinet meetings the last couple of times, is that, you know, as we move through the changing face of this with the variant, and the challenges that it faced, the volume of cases, that we need to do things a little bit differently, and we're not going to be able to do everything the way we used to be able to do it. And I think enforcement of this will be more of a challenge for sure, but we'll do the best we can, and would ask all islanders to just, you know, do what they've been doing.
As you said, this is really all about keeping people safe, that they're not getting sick and dying, and that our hospitals aren't overwhelmed. Well, what evidence do you have at this point that that is a real risk? If you look at our vaccination rates, if you look at the percentage of our vulnerable population in particular that's fully vaccinated, if you look at what you're seeing in places that have had Omicron for longer, what is the level of risk here with overwhelming the hospitals?
Well, I mean, I think we talked about it last week, Steve, that we don't know exactly, but we are concerned when we see increasing hospitalization rates, for instance, in Quebec that were announced, in some other parts of the world who have, as you mentioned, had Omicron a little bit longer. I think when you get that many people who can be sick, you're going to have a certain percentage of people, and I think I referenced that earlier. You'll have people who with underlying health conditions who don't mount the same response, or who are elderly, they are more at risk of getting hospitalized. So if you have a large number of people, you'll end up potentially getting more hospitalizations and more severe outcomes. So that's why, again, getting some time to get the boosters into those who, you know, and really the highest risk groups are what we're trying to do in the next couple of weeks. And I know pharmacies, public health, all getting wanting to booster folks. So it is it is looking at what is ahead that we're learning from, but also a little bit about what we don't know with that many people ill.
And I just add that just the limitations we have in capacity have always made us go a little bit more quickly than some of the other jurisdictions. We have to be a little bit more mindful because, if you I know on our premier's call yesterday with Atlantic premiers, I think there's 9 hospitalizations in Nova Scotia, for example, right now. That was the number as of yesterday. 9 hospitalizations in P.E.I. is a lot different than 9 in Nova Scotia, and our capacity to handle that, becomes a challenge. And just, I'm not an epidemiologist, and I've only been learning a lot of this through 21 or 22 months like the rest of us have, but just the sheer law of averages would suggest that as we get up into 400 and 500 and 600 case levels, that we're going to see people who, as Dr. Morrison says, are immunocompromised, who have some challenges that are going to end up in hospital, and that's just the reality, and we're trying to brace for that the best we can.
Okay, thanks so much.
Thanks. Allison?
Hi, thank you very much. I'm really glad to hear Santa's doing well and will be able to make his rounds as usual. I was hoping you could clarify the contact tracing. It sounds like people are going to get an email. Is that close contacts, or I just kind of lost the thread there in the middle?
Well, so I'm glad to clarify. So as it is right now, usually someone in our office, including myself, may call, when we get contacted from the lab, we call the cases themselves who are confirmed positive for COVID-19. And then public health nursing comes and also contacts the case and makes a list of, talks to them about where they may have been, but also who they live with, for instance, who they played with or who they had lunch with, so people who are close contacts. And those are the folks that really get identified, and we will continue to try within our much of our capacity of public health to contact those close contacts. And then ultimately, we sometimes also get the case themselves to help us say, look, you need to isolate and go get tested, and get tested and go home. So, and stay put. And then it gives public health a chance to get a hold of the highest risk close contacts. But in terms of a class at school, I know the school system has been really supportive in the last week, helping us email out. We have a sort of standard letter that we can communicate out to everyone in a classroom. And so they may only receive one call, for instance, from public health, as opposed to a call every day. And we really need to look at that. Most, if you're a parent or a student and you get a call and you know what you have to do and when you need to be tested, you're not going to get a call every day to make sure you're following that. But we'll try to make sure you're called once at this point in time and know what you have to do in terms of isolating and testing. And but we also are prepared that if, we may have to adjust if we have hundreds of cases, but I'm hoping we don't. But it's a lot of work. Every case and their contacts and their public exposures, it takes a lot of work. And people sometimes don't remember everything the first time, right? And so sometimes my call with them is just to say, okay, well, when public health nursing calls back, maybe between now and when they call you back, you can take some notes of who you might have been with, what their names and phone numbers are, and help pull that together for public health.
Great. And do we have any, I was wondering also about the recent cases. You say there's over 100 now in the last few days. How many of those were vaccinated versus unvaccinated?
We will update that on the web. I don't have that here. Certainly we know that we're seeing vaccinated and unvaccinated people who are getting what we call breakthrough. And that's one of our hopes, that being vaccinated will protect you regardless from severe illness and hospitalization. And there have been, out of our 115 cases in the last week, there have been some who have had to seek out medical attention through the ER, or we have occasionally had EMS or paramedics go to someone's house, make sure they're doing okay. They have not required hospitalization. And really, I know I share this collectively with everyone. We just want everybody to be okay.
And do we know about any insight in the severity of the Omicron illness yet? What's the rumor on that from other countries? It's not a rumor, I know.
I mean, and I think I tried to mention that too. I think there's certainly there were early reports that it may not be as severe, or the virulence may not be quite the same. But I think we still have a lot to learn about it in the next 2 or 3 weeks. Probably we'll learn more. I know nationally, when I meet with my colleagues across the country, we're trying to share anything we're learning from our own respective jurisdictions about severity and what we're seeing. I would say that most of the cases that we're seeing are symptomatic, whereas we had a higher percentage in some of the earlier strains of COVID that people didn't have any symptoms, which is its own concern because people don't know they're spreading. But the vast majority of these people that I've talked to in the last week are symptomatic.
Okay, that's perhaps helpful. And the breakdown of the 21 cases, like the cases that are like 21 yesterday and 29 today, do we have a breakdown of like ages or if they're travel related? You had a percentage.
Yes,
for the 115.
and so we'll put that kind of detail on the website too. That'll be updated. I just didn't want to list that many. How many are in their 20s? How many in their 30s? We can, and I put percentages there, but we can have numbers associated with them too.
Great. Okay. And I had wondered about cases in schools, but I think you had touched on that in the briefing as well. Was there anything else you kind of wanted to, like, is there anything other than the Westwood that would be considered an outbreak?
Not in terms of a school. These were individual cases, and so they would have been exposures at the other schools, but not considered an outbreak. And in some ways, that's why the school holiday couldn't come at a better time.
Great. Thank you very much.
You're welcome.
Thank you, Alison. Now we can go online, perhaps?
Pascal Rachnogo, Radio Canada.
Ma question, c'était pour la docteure Morrison. Est-ce que vous pouvez nous expliquer en français un peu qu'est-ce que vous voulez accomplir en imposant l'isolement de 4 jours et en fermant les restaurants et les bars à 23 heures tous les jours? Qu'est-ce qui est votre objectif en français, s'il vous plaît?
Alors, bonjour. Alors, c'est une bonne question. C'est vraiment de ralentir la transmission de COVID-19 à Omicron ici à l'île du Prince-Édouard. On veut diminuer le risque si les personnes arrivent ici. On trouve qu'ils sont, même s'ils sont négatifs, quand ils arrivent depuis 0 et 4 jours, souvent, il devient positif. Alors, si on ne s'isole pas, on va transmettre aux insulaires ici. Alors, essayer de réduire le nombre de cas, réduire le montant de transmission et même pour les bars, les restos qui ouvrent ou qui ferment à 23 heures, essayer de diminuer le contact après 11 heures le soir. Pour la même raison. Si on peut diminuer les contacts qu'on a, diminuer la transmission, ça va peut-être ralentir. Ça ne va pas éliminer, mais ça va ralentir, j'espère, Omicron un peu.
Et ma dernière question, c'est qu'est-ce qui est votre message aux gens de l'île du Prince-Édouard pour le temps des fêtes? Vous l'avez dit en anglais, vous leur demandez de ne pas faire de rassemblement pour la veille du jour de l'an, pas de office party. Donc, qu'est-ce que votre message aux gens du Prince-Édouard pour le temps des fêtes?
C'est un temps assez difficile pour annoncer vraiment ces mesures, mais c'est le temps de ne pas faire des sorties avec beaucoup de gens, c'est de garder vos contacts petits, le nombre de contacts assez petits, et puis qui sont même les mêmes gens avec qui vous avez du contact. On sait, l'évidence suppose si on a seulement 50%, 40% de notre contact, réduire les contacts par 40 à 50%, ça peut aider à ralentir la transmission. Alors, ça va, le message est vraiment les fêtes seraient différentes. Et pour plusieurs, je comprends, difficile, mais d'essayer de faire tout ce qu'on peut pour réduire le risque de transmission. Et on veut que le système de santé soit là pour nous et pour tout le monde.
Merci, Dr. Morrison.
De rien.
Maya Chabal, Radio-Canada. Oui, bonjour. Ma question, c'est aussi pour Dr. Morrison. Je sais que vous l'avez dit en anglais tout à l'heure. Alors, je voulais juste vous reposer la question en français. Et je voulais savoir donc, pourquoi, pour l'instant, les tests rapides ne sont pas déployés ou disponibles, en fait, pour toute la population de l'île du Prince-Édouard.
Bonjour. Alors, on a seulement un montant qu'on a ici à l'île du Prince-Édouard. On utilise beaucoup de tests rapides vraiment au point d'entrée depuis juin. Mais pour les tests que vous pouvez ramener chez vous, on veut avoir un montant pour les points d'entrée pour ramener, pour faire les tests à 2 jours, 4 jours. On veut avoir des tests pour les personnes qui travaillent en santé, les healthcare workers, pour si on a trop de personnes qui sont les close contacts, on peut les faire utiliser en cette manière. On veut avoir pour protéger les résidents de foyers de longue durée. On veut faire les tests pour les personnes qui travaillent là-bas moins de 2 fois par semaine. Alors, on veut les utiliser là. Et puis, les autres, on veut mettre aux endroits où ils n'ont pas le même accès aux tests PCR. Et puis, si on a plus de tests qui arrivent, on va les distribuer. On va pas laisser les tests rapides s'asseoir sans avoir vraiment une raison pour être là où ils vont être distribués les tests qu'on a reçus du gouvernement fédéral, et on travaille avec le gouvernement du Canada pour recevoir de plus en plus de tests.
Donc on pourrait s'attendre à ce que, éventuellement, dans les prochaines semaines, peut-être, je ne sais pas si vous avez une chronologie, mais on pourrait s'attendre à ce que les programmes de tests rapides soient élargis à l'ensemble de la population d'ici un certain temps.
C'est pas vraiment peut-être pour tout le monde, mais on veut, par exemple, on veut que tous les étudiants reçoivent quelques tests avant de retourner à l'école. Alors, on va travailler avec le système d'éducation pour que tous les étudiants ont accès à les tests rapides avant de retourner. Et puis, mais j'ai dit en anglais, c'est les tests qui sont pas diagnostiques. C'est vraiment un screening test, et il faut les utiliser avec un peu de caution, vraiment, mais ils peuvent nous aider dans cet stage de l'épidémie.
Merci beaucoup.
De rien.
Louise Martin, CBC.
Hi to you both. Thanks for taking our questions today on I can tell, a very challenging day. I'm going to start by asking you about booster shots. And we keep hearing the importance of booking your booster, but we're also hearing a lot of frustrations from Islanders that just can't seem to get through. They can't book online. Are there any plans to offer more clinics for the booster shot? I mean, the pharmacies have their own rules. and any consideration to shortening the gap between doses. Other jurisdictions have said, okay, you can book after 3 months. So just wondering if there will be any update on maybe a mass clinic for boosters, anything like that?
Hi, Louise. So, I mean, in terms of the interval, I think I said this last week too. We are following the NACI recommendations, and will continue to do so, following the best evidence around the interval, because we not only want to protect Islanders this week, but we want to make sure they're protected through the winter and the upcoming months. In terms of the booster clinics, I've also heard some of those, difficulties getting access to the booster clinics. And so I think Health P.E.I. I know is working to add clinics and to increase their capacity to administer third doses by adding more clinic appointments, as well as pharmacies are going to be doing the same. And I know there's ongoing active discussions about putting the more clinics and bigger clinics in place. So those are ongoing, and I think we all share that real keen desire to get as many people who are eligible boosted. We know a large number of Islanders, based on when they had their vaccine, their second dose, are due in January. The biggest number of people will become eligible over the course of that month. And so we need thousands and thousands of people boosted during that period of time. So it will be, I think I said last week, it's going to be an all hands on deck trying to use boosters. We can't booster our way out of this wave, but we can certainly help try to protect those who are vulnerable for severe outcomes by getting them boosted.
So there is no issue with supply of vaccines on the island?
No, we have ordered in the vaccines and continue to work really regularly. Our office is in touch with the national sort of vaccine distributors at bringing in our vaccine as required.
Can you confirm that there are some cases, I'm not sure how many, connected to the QEH somehow? We've been asked a lot about that recently. Is there any confirmation of that?
Well, usually that would be up to, I mean, we try not to identify certain workplaces, but there have been, there's not an outbreak, but there have been individuals who've acquired COVID outside of the hospital who are staff at the QEH.
Thank you. And this is a question I would love if you could both answer this. I can see how heavily this is weighing on both of you. You're trying to hide it well, and you're doing an admirable job at that, even mentioning Santa. I'm sure a lot of kids at home appreciate that, Dr. Morrison. But, in terms of your level of COVID weariness, COVID fatigue, and how difficult this is to, once again, going back to announcing isolation rules, restrictions, especially at this time of year, can you give me some insight into just how hard this all sucks, let's just say it, but how hard this is for both of you today?
Well, hi, Louise. It is the worst thing really to have to do, and however hopeful we were leading up to the last few weeks, I mean, the reality is we're here today. It's just really horrible. I mean, I can only think of what it's doing to families, because I look at, as I said, my own. We're about 49 or 50 when we bring the extended family together, and Christmas Eve has always been the big gathering for us, and this is the second year in a row we're not going to be able to do that. My kids are getting a little bit older; they're missing out on that, and and that's really horrible. That's and so when we think about these decisions, those are the things that certainly I bring to the table, and members of our cabinet bring to the table, and Dr. Morrison brings to the table, is that behind every one of these decisions is somebody impacted in a negative way, and you don't ever want to do that, and it's hard, it's horrible, but at the same time, we have a responsibility to try to do everything we can to keep people safe. And, we talk about this often. I would rather do this and people be safe than not do this and people be impacted, get really sick or worse. And that's how we've come to this decision, but certainly don't want to be here and making this decision today. It's just it's the worst of the worst.
Yeah, Louise, I know my colleague in Newfoundland, when they announced similar isolation that it's going into effect, I think today, she was, visibly upset for the same reasons the Premier talked about, the impact on each of us. This is not something that, none of these measures only impact others. They impact each of us. And we're dealing with weary families, weary individuals, a weary community. But have to try to still continue to bear that responsibility and make decisions. And I guess we all are making decisions to try to protect each other. And that's hard after this much time. And all I know is that in this windy road that we've been on, we are going to get through it. And it's taking longer than I think the Premier and I would have ever imagined. And I do think this is going to help. This is going to get us through this. Like, we are going to get through, and we are going to be living with COVID in a very different way in a few months. But this real pressure on potential pressure on our system, we need to pay attention to. But I know, Louise, it's just it's hard. It weighs heavy on us, and difficult decisions, I think, usually do.
All right. Thank you to you both for your time, and hope you get a little bit of downtime.
Thanks, Louise. You too.
Patrick Butler, Radio Canada.
Bonjour, question pour la Dr. Morrison. Vous l'avez dit en anglais, mais j'aimerais vous l'entendre là-dessus en français. Ces gens qui essayent de prendre rendez-vous pour recevoir la 3e dose du vaccin et qui sont incapables de le faire en ce moment, est-ce que ça vous inquiète? Puis qu'est-ce que vous allez faire pour régler la situation?
Bonjour Patrick. Je sais qu'il y a des discussions avec Health P.E.I. et puis aussi avec les pharmacies pour vraiment augmenter le nombre leur capacité de donner les boosters. Je sais qu'ils comprennent très, très bien l'importance d'avoir les boosters, mais aussi de continuer de faire les vaccins pour les enfants. Alors, ils ont beaucoup de pression vraiment il faut en faire. Alors, ils regardent pour ajouter les cliniques, ajouter le nombre de doses qu'ils peuvent faire chaque semaine. Alors, je pense dans les prochains jours, on va entendre plus d'informations et les détails à propos des nouveaux cliniques.
Et juste pour vérifier, vous avez entendu ce genre d'inquiétude de la part des résidents?
Oui, on reçoit des appels et des emails, les courriels pour dire c'est difficile de trouver une place pour mon booster. Alors, et puis on sait qu'il y a le plus grand nombre de personnes qui sont éligibles, qui ont besoin d'un booster. Ça arrive en janvier. Alors, on va avoir beaucoup de personnes qui ont besoin d'un booster pendant les prochaines semaines.
Et dernière question, est-ce que pendant le temps des fêtes, pendant Noël, le jour de l'an par exemple, est-ce qu'il y aura des cliniques de vaccination à l'île du Prince-Édouard?
J'espère qu'entre Noël et le 1er janvier, ils vont avoir les cliniques. Alors, encore, j'attends aussi les détails à propos des cliniques.
Merci.
De rien.
Well, thank you. I think that brings a conclusion to the questions. And just before we sign off, I'd like to also, with the extreme optimism that this is the last time I see you before December 25th. Just thank everyone behind the scenes who makes this happen. It looks like a very simple and seamless operation, but it's anything but. So to everyone who to make that happen, to CPHO, to all the staff at Health P.E.I. and education and so many other departments and so many other professionals who have dug in, thank you. To Dr. Morrison, of course, my admiration grows for her daily. She's strong, smart, funny, and consistent, and she's the same behind the scenes as she is in front of the camera. So just to you, thanks. To everyone out there, if it's Christmas you celebrate or whatever other you might be celebrating this holiday season, do so. Sometimes it's hard to find, particularly now, something to be thankful and grateful for, but there's always something. So all the best and Merry Christmas.